Hello, welcome to my YouTube video. My name is Hafia and this is my groupmates Amira, Zubaida, Adawiyah and Azri. In this video, we will learn about Turner syndrome, or also known as congenital ovarian hypoplasia syndrome. It is a chromosomal disorder which only affected by females. It is first found by Dr. Henry Turner in the year 1938. Based on this statistic, the prevalence of Turner syndrome is estimated at 1 in 2,000 live-born female infants. In addition, approximately more than 70,000 females in the United States are affected with this syndrome. How a person gets this syndrome? It is not inherited by parents, not related by mother's age and environment. They are also not known for any racial or ethnic factor. So, it happens randomly in affected female's body. So, every human have their own DNA which wrap nicely in 46 chromosomes. Each of the 46 chromosomes is actually part of a pair of chromosomes. Since you get one from each parent, so 23 pairs. Of these 23 pairs, one pair is different between boy and girl that called as sex chromosome X and Y, which determine biological sex for human body. Boy have XY chromosome while girl have XX chromosome. As each parent donate 23 chromosomes, sometimes one parent might donate one chromosome, either it is too many, known as trisomy, or one less, known as monosomy. Monosomy is what happens in Turner syndrome, which specifically affects the X chromosome. Turner syndrome can cause by 4 types of genetic alteration which result either fully or partially missing X chromosome. First is monosomy X. It is the most common cause of genetic alteration in Turner syndrome. As I said earlier, monosomy is a condition where a person is missing one chromosome in a pair. This means a girl with Turner syndrome has only one X chromosome in her 23rd pair. This error is caused by non-disjunction. Non-disjunction is a failure of pair chromosomes to separate during cell division, which results in both chromosomes go to one daughter cell and none go to the other. When an egg is fertilized in one of these sperm cells, a girl will get Turner syndrome. Next common cause is mosaic Turner syndrome or 45X mosaicism. In an affected individual, it occurs due to a random event during cell division in early fetal development rather than before conception. As a result, some of an affected person's cells have the usual 2 sex chromosomes and other cells have only one copy of the X chromosome. Other sex chromosome abnormalities are also possible in females with X chromosome mosaicism. In rare cases, Turner syndrome may be caused by a missing or an abnormal piece of the X chromosome. Cells will have one complete and one altered copy. These abnormalities can be either partial deletion, isochromosome X, or ring chromosome. In a very small percentage of Turner syndrome cases, some cells have one copy of the X chromosome, while other cells have one copy of the X chromosome and some Y chromosome material. The amount of Y chromosome is not sufficient to induce any male characteristics, but is related to the increased risk of a type of cancer called a gonadoblastoma. What are the symptoms for a patient with Turner syndrome? Symptoms and signs for Turner syndrome differ among girls and women with the condition as they can be subtle, slowly developing, or significant. These symptoms may be visible earlier in some girls than the others, especially in the context of poor growth and physical features. Most common signs in almost all patients with Turner syndrome are short stature and ovarian failure. First is short stature. Short stature is a condition where a person does not grow as tall as other people of the same gender and age. It is the effect of the missing X chromosome in their body. A person may experience slow growth. In childhood, growth spurt does not occur at expected times. In adolescence, growth spurt is essentially absent, and in adulthood, the adult head is significantly lesser than other female family members. The second one is ovarian failure. Normally, a girl's ovaries begin to produce sex hormones, estrogen and progesterone, at puberty. However, this does not happen in most girls who have Turner syndrome, as they have only one complete X chromosome which affects their reproductive system. A girl or a woman may experience, first, unable to begin sexual changes expected during puberty, second, absence of breast development, third, primary or secondary amenorrhea, fourth, early end to menstrual cycles not due to pregnancy, and lastly, inability to conceive a child. Females with Turner syndrome also have special physical appearance such as low hairline, webbed neck, shield chest, full breast development, elbow deformity, short metacarpal 4 and 5, short fingernails and toes, brown spots, and lymphedema. Turner syndrome can affect the proper development of several body systems. Complications that can occur include cardiovascular disease, cognitive, osteoporosis, hearing and vision problem, autoimmune disease, kidney problem, and infertile. But an individual may experience only some of these complications. Can this disorder be cured? Turner syndrome cannot be cured because it is a chromosomal disorder. It is a genetic problem that is caused by a random error that leads to a missing X chromosome in the sperm or egg of a parent. There is nothing the father or mother can do to prevent the error from occurring. However, treatment approaches may be available to treat or manage some of the associated signs and symptoms. The treatment include growth hormone therapy, estrogen replacement therapy, health checkups, and pregnancy and fertility treatment. The first one is growth hormone therapy. It is a daily administration of recombinant human growth hormone as injections for patients with Turner syndrome. It is recommended by endocrinologists to increase the heat of patients during expected times of growth spurts in early childhood until the early teen years. It acts as a way to prevent short stature and also improves bone growth. Furthermore, oxandrolone may be co-administered along with the growth hormone for girls with very short stature. It acts by raising the production of protein and improving bone mineral density in the body. The second treatment is estrogen replacement therapy or ERT. It is a treatment for estrogen deficiency in girls with Turner syndrome. Majority of girls with Turner syndrome require ERT in order to begin puberty. ERT is usually started at the age of 12 years old or as early as 5 years old. ERT often continues throughout life until the patients are about the age of 50 and reach menopause. Small doses of estrogen allow girls to develop secondary sexual characteristics. It triggers changes such as breast development and improves the size of the uterus. Next treatment is health checkups. Perform regularly health checkups is vital for this patient as they can develop various medical complications alongside the disorder. Several specialists may need to take part in the treatment to screen, diagnose, and recommend appropriate care for the patients throughout their lives. Lastly, pregnancy and fertility treatment. Women with Turner syndrome have a low possibility of becoming pregnant due to the failure of ovaries and subsequent infertility experience very early in adulthood. Therefore, they need to undergo fertility treatment to prepare the uterus for pregnancy using specially designed hormone therapy. Some women with Turner syndrome can become pregnant after performing the in vitro fertilization, or known as IVF, with donor oocyte. This process requires a fertilized donor oocyte, then the resulting embryo is transferred into the uterus of the individual with Turner syndrome. Currently, the only effective way to diagnose Turner syndrome is by using prenatal genetic screening. It uses karyotype analysis to determine whether one of the X chromosome is missing or partially missing in a girl's body. There are three procedures which can be performed for prenatal diagnosis regarding Turner syndrome. First is non-invasive prenatal testing, second, chorionic wireless sampling, and third, amniocentesis. A fetal ultrasonography also can be performed during fetal development as they can disclose an image of the pregnant woman's baby having certain features of Turner syndrome. How long is the average lifespan of a person with this disorder? The mortality rate of Turner syndrome patients are 3 times higher in comparison to the normal population. This is due to the high mortality rate of neonates and adults because of other complications such as coronary heart disease and diabetes. Studies show that it is expected that the lifespan of a person with this disorder will be reduced to an average of 10 years. Despite that, treatment of the chronic disease may help in extending the lifespan of people with Turner syndrome. Turner syndrome can leave some impacts to the affected family. First is difficult for the parents to allocate equal attention or time for their other children, since a child with Turner syndrome requires full attention and fully dependent on the parents for assistance. Secondly, it will also affect the family expenses since a bigger portion of the expenses is spent on her treatment and medication supply. Thirdly, parents who acknowledge the condition of the unborn child who are tested positive for Turner syndrome might have psychological impact such as depression, frustration, confusion, or uncertainty in making the decision whether to continue with the pregnancy or not. However, one positive impact towards the family is that they might be united and face the issue together as a family. By doing so, they can overcome all the negative impacts mentioned earlier and find strength in each other. What we learn after researching this disorder are, firstly, parents should be more concerned about the progress of their child's growth. Lack of monitoring or late in providing treatment might jeopardize their child's life. Next, always treat a Turner syndrome patient just like any normal person. This will help them to build their self-esteem and confidence in themselves. And third, allow them to be involved in any Turner syndrome association and be part of a positive circle of people. Now, as a quick recap, Turner syndrome is a chromosomal disorder which only happens to female species who completely lack an X chromosome or just partially. It is an untreated and not an inherited disease. The most common cause of genetic alterations are monosomy X and mosaicism. Common symptoms of the disease are overall failure and short stature. They also have special appearance and have additional complications such as cardiovascular disease and infertile. Prenatal genetic screening can be done to diagnose Turner syndrome. Treatments such as undergoes growth hormone therapy, estrogen replacement therapy, and infertility treatment might improve their quality of life. Overall, the effects of Turner syndrome differs from one patient to another. Hence, embrace yourself, not that you are normal and special human being.